that. Thank you all for your participation today. It's been a great panel. There's been a lot of talk about context. I want to take an even bigger context than what's been referenced today and look more broadly. There's been a 50% increase in total national health expenditures since 2019. By 2028, projections call for healthcare spending to consume nearly 20% of our nation's GDP. Health insurance premiums are skyrocketing. And for all this additional money that we're spending, our actual health outcomes are not improving at all. In fact, many indicators suggest we're getting less healthy. So, and what I've learned, I've only been here for 8 months, is when you talk to the different players in the healthcare industry, it's a lot of this. Somebody else is to blame. So enter AI, which I think has very serious, downfalls and potential risks, but also incredible upsides, which many of you have highlighted today. So I want to drill into some of those. In your conversation with Mr. Landsman, he correctly outlined some concerns about the pre-auth. When I go home and talk to healthcare providers, this is their biggest issue, is how much time and expense and delays it takes to get through the pre-auth process. So how can we use AI and not just say AI is bad, it has to be, it has to only be human beings. How can we use AI and provide the right guidelines and parameters to protect against the death panels and these blanket, disapprovals, but use the best of it to help us improve the pre-auth situation so that patients get their care faster? And I'll turn that over to you, Mr. Parker and Mr. Toy.
That's a great question. Thank you for the question. I think we've heard a lot of conversation today about prior authorization and automating both sides of that transaction, but we've heard a little conversation about how to actually help the consumer navigate that problem, and very little sort of investment and energy into that. And so our frame of reference here is how do we enable the consumer to both understand what their options are, understand what the price is, and in the world where a prior auth is required, help them both navigate that prior auth and ultimately get it approved if it's appropriate. And I think if we can reorient a bunch of this energy into that experience, and oftentimes that might mean that there's a lower level of acuity, a lower level of care that's more appropriate, and the consumer might be happy to utilize that level of care. They just don't have any of that information. They don't really understand how to navigate any of this. And so we're super focused on how do you help the consumer figure out the right level of care, and in a world where that does require a prior auth, help them get that prior auth approved.
Okay, and I'm going to come back to you with a follow-up question after Mr. Toy speaks, but the question will be, what do we need in terms of rules, guidelines, or incentives to make that happen? So, Mr. Toy.
Yes, and thank you for the question. So something that I think can definitely help is that something I use my experience at Clover for, since we run a plan, is I actually advise on the Marfan Foundation for the Rare Disease. I advise our expert clinicians and I advise patients on how to navigate their own prior auth. So you can think about that as using expertise to say, this is how you talk to an insurance company to get them to cover your care. And so something we're looking at doing on the Clover side is providing actually that in a chatbot form so that people can say, hey, this is what I'm trying to get covered. What's the right way to get that covered? And then that will synthesize the data, roll out the documentation for you, package it up, phrase it in a way that makes it easy for the insurance company to say yes to. And I think that will greatly help.
Cool. Mr. Parker, how do we incentivize this?
I largely agree with that. I think we're building a very similar experience where we can take your full medical record, use AI to analyze it, help justify what procedure or medication you might need based on your clinical record, and then, to Mr. Toy's point, package that up in a way that the insurance company can approve that. And I think this is a place where the AI is very capable and the data is now available enough to make that experience really possible. And I do think it's a place where if you can execute that customer experience, it will both be more convenient, more sort of understandable, and ultimately help them get these things approved.
Okay, I have 20 seconds left. Does anyone else have short thoughts to offer?
I'll just say there's enormous opportunity that we're trying to explore, that the things that you need for prior authorization are predictable, they're public information, they're online. Wouldn't it be great to know that when a patient's in front of you, I just have to ask them these 2 more things, and that'll meet the 10 things that I need to do. So we're exploring other real-time ways to notify physicians of what else is left on that checklist, so that before the patient goes home and then you have to bring them back and require new things. So in the works.
Very good. Thank you all. Appreciate your insights today.
Okay, the gentlewoman yields.